The fluorescent lights hummed their mechanical prayer above the cardiac unit at Oak Creek Memorial, casting everything in the colorless glow of late evening. Megan O'Brien moved through the corridors like a ghost passing through walls, present, necessary, invisible. Her scrubs were standard-issue navy blue, the fabric soft from 100 washings, and her name badge hung at chest level where no one ever looked long enough to read it. She had been a senior chief petty officer in Navy combat medicine for 8 years before she became this, a night shift nurse who charted obsessively, asked no questions, and never challenged protocol. The uniform was long gone. Folded into a cedar chest in her bedroom closet at the small house in Aurora, Colorado, the one she rented under a lease that required no background checks beyond a credit report. Her 13-year-old son, Marcus, thought his mother had always worked nights. He thought she had always been tired. He thought everyone's hands moved with the kind of practiced efficiency that came from handling 4s on a busy shift, not from 8 years of field medicine in Helmand Province. Marjah had broken something inside her that wouldn't heal. That was what the VA psychiatrist had said before she stopped going. It wasn't trauma, exactly. Trauma was too small a word for what happened when you had held intestines in your hands while mortars fell around you, when you had applied tourniquets to legs that would never work again, when you had pronounced 17-year-old Lance Corporal Thomas Kirkwood dead in a marketplace outside of town. The thing that broke was different. It was the part that knew how to be among people without feeling like an intruder. So she chose nights. The cardiac unit was quieter after midnight. The attending physicians made their rounds and left. The patients slept, or tried to. The machines kept their rhythmic vigil. The only sound was the occasional beep of a monitor and the whisper of ventilators, and Megan could move through the ward like she belonged there because her invisibility was useful. Nobody needed to see her. They only needed the work to be done. She was charting at the station near the nurse's desk when Dr. Hargrove arrived for evening rounds. His shoes announced him first, expensive loafers, Italian leather probably, the kind that required professional polishing. They clicked against the linoleum with the precision of a man who believed that sound was a form of authority. He was tall, with the posture of someone who had never been told no, and he carried a tablet that glowed with patient information like a badge of institutional power. Megan didn't look up from the computer screen. She had learned in the first week that eye contact with Dr. Hargrove invited conversation, and conversation invited scrutiny, and scrutiny made people uncomfortable. Not Hargrove. But the other nurses. They didn't like it when someone new seemed competent on the first day. They didn't like it when someone asked about medication interactions or questioned the dosages written in the orders. So Megan had learned to keep her head down and let her hands do the talking when nobody was paying attention. "O'Brien," Hargrove said, not as a greeting but as a summoning. She looked up. He was studying the patient roster on his tablet, not looking at her. Patient info 12. Needs a line for contrast. Standard post-op care. "I'll get to it," Megan said. 10 words. Soft. Deferential. The tone of someone who understood the hierarchy and accepted her place in it. Hargrove nodded once and moved to the next station without another glance. This was how he preferred his staff, competent, quiet, and absolutely certain of their subordinate position. Megan watched him go, noting the way he didn't acknowledge the medication she had already prepared for the patient info 12, or the fact that she had already hung 2 units of blood plasma in the refrigerator below the nursing station, anticipating exactly what he would order. He didn't see her. He saw a nurse who took directions and performed tasks and disappeared when the real medicine was happening. The cardiac unit at this hour existed in a state of controlled quiet. The antiseptic smell layered over everything, bleach and saline solution and the particular scent of medical-grade tubing. Outside the windows, Denver sprawled across the plains, streetlights reflecting off wet pavement after an earlier rain. Inside, the machines kept their own conversation. Ventilators wheezed in steady rhythm. Heart monitors traced the electrical storm of each patient's pulse in green peaks and valleys. For pumps beeped softly when they wanted attention. Megan finished her charting and headed to room 412. The patient was a 63-year-old man named Victor Reeves, 3 days post-op from a triple bypass, and according to his chart, he had spent the last 30 hours complaining about chest pain in a way that made the day shift nurses reluctant to answer his call button. Megan had read the notes. She had read them twice. The pattern was wrong. The pain was following a trajectory that didn't match typical post-operative discomfort. His vitals showed subtle changes, heart rate climbing half a beat per minute, blood pressure drifting up, oxygen saturation dropping so gradually that nobody else had noticed yet. She pushed through the door quietly, letting it close without a sound. "Mr. Reeves," she said, and he looked at her with the confusion of a man in moderate distress. "I'm going to get that line set up for the contrast study. This will help us see how your new vessels are healing." "Finally," he said. His voice was tight, strained at the edges. "The pain keeps getting worse. Nobody believes me." "I believe you," Megan said. And then she moved with the kind of practiced efficiency that came from 8 years of trauma medicine. She opened the line kit with one hand while assessing his arms for access. His left antecubital fossa had perfect veins, straight, prominent, healthy. She didn't need to palpate more than once. The muscle memory was still there. It would always be there. "This is going to be a tiny pinch," she said, and she inserted the 18-gauge catheter with a kind of fluid precision that took exactly 3 seconds from tourniquet placement to needle advancement to successful placement in the vein. The flash chamber filled with blood. She secured the line and drew labs without being asked, CBC, CMP, troponin levels. The work of a competent nurse. The work of someone who had learned to predict what the doctors would need before they asked. "You're good at this," Reeves said, the tension in his voice momentarily replaced by something almost like relief. "Just practice," Megan replied. She labeled the tubes and positioned them for lab pickup, then checked his foresight one more time. The dressing was secure. The line was patent. Everything was exactly as it should be. She was reaching for the door when his heart monitor chimed softly, just once, a single irregular beat that would have been nothing to anyone else. To Megan, it was a question being asked by his cardiac tissue. She turned back and looked at the monitor screen. The rhythm was sinus, regular, but that single ectopic beat had carried information. Pain was data. Pain was information. These were things they taught in combat medicine, and they were true in civilian hospitals too, though nobody seemed to remember it. She made a note. Ectopic beat noted at 22:06. "We'll monitor closely." Then she returned to the nursing station and added Mr. Reeves to her personal watch list, the one she kept in her head, the way every good medic did. Dr. Chen arrived at 23:15. He was a surgical resident, 3rd year, with the kind of exhaustion that came from being on call for 36 hours straight. He carried a fresh tablet and a steaming cup of coffee that smelled like survival. He was reviewing post-op patients when he stopped at the chart for room 412 and started reading Megan's notes. She saw him pause. She saw his eyes track through the vital signs she had documented every 2 hours since her shift began. She saw the moment something clicked for him, the trajectory of the data, the pattern that was emerging, the subtle wrongness that shouldn't have been subtle. He looked up from the tablet and found her at the station. "Who charted this?" he asked. "I did," Megan said. Dr. Chen walked over to her station with his coffee cup held carefully away from the computer. He was younger than Hargrove, maybe 35, and he had the kind of face that hadn't learned how to hide his thoughts yet. "Walk me through the last 12 hours, he said. So she did. She pulled up the vital signs on the main monitor, expanded the timeline, showed him the subtle upward trend in heart rate, the minimal but consistent decline in oxygen saturation, the blood pressure that had climbed from 128/78 to 134/82. She showed him the single ectopic beat she had noted. She showed him the labs she had drawn, which wouldn't come back until morning but were already in the queue. Dr. Chen stared at the screen for almost a full minute without speaking. Then he said, "Why didn't anyone call this? Why didn't the day shift flag this?" Megan shrugged. "They followed protocol." What she didn't say was, "Protocol is for people who haven't learned to see yet." What she didn't say was, "The numbers tell a story if you bother to read it." What she didn't say was anything that would have revealed her, exposed her, made her more than the quiet nurse who stayed until the end of her shift and then disappeared into the Denver night. "I'm going to check on him," Dr. Chen said, and he left his coffee at her station, a small gesture of trust, or maybe just forgetfulness. Megan didn't touch it. She watched him walk toward room 412, watched him disappear behind the curtain, and then she returned to her charting. The rest of the night unfolded in the quiet rhythm of the cardiac unit. At 2:36 a.m., her phone buzzed. Marcus had sent a text, "Did you work late? Bed feels empty." She didn't respond. She never responded to texts during her shift. The work required her full attention. The patients required it. That was the hierarchy she understood. But something had shifted. Dr. Chen had noticed her. Not in the way that would make her life harder, like Hargrove's notice did, like the other nurse's attention did. He had noticed her competence. He had noticed that she could read the language of vital signs and equipment and the subtle wrongness of a patient's trajectory. And that kind of notice was dangerous, because it suggested that maybe her invisibility wasn't quite as complete as she had believed. Dr. Hargrove moved through room 412 like a man who had never been questioned in his life. His white coat caught the fluorescent light as he stopped at Admiral Kincaid's bedside, the Admiral's daughter Sarah standing rigid in the corner, her hand still gripping her father's shoulder. Megan adjusted the 4-line with methodical precision, checking the drip rate, confirming the placement was clean, catheter secure in the Admiral's left antecubital fossa. She had done this procedure 2,000 times. Maybe 3,000. The muscle memory was automatic. The competence was invisible. "Nurse O'Brien, step away from that patient immediately." Hargrove's voice carried the particular edge of a man accustomed to compliance. The hallway went quiet. Other nurses paused at their stations. "You just contaminated a sterile field with your incompetent technique. Did you even graduate nursing school or did you buy your credentials online?" Sarah Kincaid's face drained of color. The Admiral, 71 years old and already fighting multi-organ failure, watched Megan with the kind of intensity that suggested he understood what was actually happening beneath the words. Megan took one measured breath. Let it fill her lungs. Release it through her nose. Her hands did not shake. Her voice did not waver. A single tear traced down her cheek, not from shame, but from the sheer effort of restraint. The weight of 8 years compressed into one moment. Marjah. The screaming. The mortars that didn't care how careful you were. She wiped the tear away without breaking eye contact with Hargrove. When she spoke, her voice had dropped half an octave. "I've held intestines in my hands while mortars fell. You'll have to do better than a write-up, doctor." The room went dead silent. Hargrove's face darkened, a vein surfacing on his temple like a warning. He opened his mouth, closed it, turned on his heel and gestured sharply toward the door. "Out! Now!" Megan left without a word, moving with the kind of fluid composure that comes from having already survived the worst. Behind her, she heard Sarah Kincaid's voice, small and confused. What was that about?" The Admiral didn't answer. He was watching the doorway where she'd been standing. 2 days later, the break room at Oak Creek Memorial smelled like reheated coffee and the particular staleness that comes from nobody ever opening a window. Megan sat down at the table with her lunch container, leftover chicken and rice she'd prepared on Sunday, methodical and measured, the way she did everything. Chen was there. Rodriguez. Martinez. Williams. For nurses who had worked the same shifts she had for 8 months. For nurses who had watched her spot the signs of sepsis before the attending, catch the potassium levels nobody else had noticed, move through the unit with a competence that shouldn't belong to someone who just pushed meds and recorded vitals. The moment her chair scraped against the linoleum floor, Chen gathered her yogurt container and stood. Not slowly. Not with hesitation. With purpose. Rodriguez followed 3 seconds later, sandwich abandoned mid-bite. Martinez stood without looking at her. Williams last, a small shake of her head like apology or explanation or both. The break room door swung shut. Megan sat alone under lights that buzzed like distant machinery. Her sandwich remained untouched. The room held the kind of quiet that happens after something final, not peaceful, but conclusive. She could hear the wall clock ticking. The refrigerator humming its monotonous hymn. Somewhere down the hallway, a monitor beeped. A normal night at Oak Creek Memorial. A normal night for someone who had never existed in the first place. But the isolation was strategic. That's what made it different from simple cruelty. Cruelty was emotional. What Hargrove was doing was architecture. Friday morning, the unit disciplinary board near the nurses' station had been rearranged. The laminated sheets that documented shift schedules and protocol updates had been moved aside. In the center, written in red marker bold enough to be read from the elevator, was a new entry, M. The Brian, medication error, patient safety violation, written warning. The words weren't technically a lie. Megan had documented a patient receiving a dose of metoprolol 8 hours later than prescribed due to a pharmacy delay. She had noted it in the chart. She had flagged the discrepancy. Protocol followed. Standard nursing practice. But when Hargrove's administrative assistant transcribed the incident, the pharmacy delay disappeared. Only Megan's name remained, bold and red and visible to every person who walked past during shift change. 12 staff members passed the board during the handoff at 0700. Megan stood at her station, back to the wall, spine straight, hands working through the morning preparations. Vital signs to check. Charts to update. The small, precise movements that comprised invisibility. She felt each pair of eyes that landed on her, not hostile, exactly, but uncertain. Evaluating. Recategorizing. A nurse with a written warning was a nurse who made mistakes. Mistakes meant liability. Liability meant distance. Hargrove stood in his office doorway, arms crossed, a slight smile playing at the corner of his mouth. He had already made the calls. One to hospital board chairman Mitchell, who owed him for a DUI cover-up from 2019. Hargrove had contacted the responding officer, suggested the breathalyzer had been improperly calibrated, recommended the whole thing disappear. The favor was now collected. The call had taken 40 seconds. I need to discuss a problematic employee. The second call went to the Colorado Medical Board. A formal complaint. A nurse operating outside her scope. Potential fraud. A voicemail left with the complaint line at 2,100 hours, professional and measured, the kind of accusation that didn't need to be true to trigger an investigation. The machinery would move now. Letters would arrive. Megan would have to respond. Resources would be consumed. Time would be lost. The third call was to a private investigator Hargrove used occasionally, the kind of man who asked few questions and fewer follow-ups. A background check on Megan O'Brien. Look into her past. Employment history. Military service if applicable. Find leverage. Find something. Hargrove had deposited $1,500 that morning and forgotten about it within the hour. The investigator would have called back within 30 minutes with preliminary information. Name change? Previous address discrepancy? Anything that suggested a reinvention rather than a simple career change. What the investigator would find, or rather, what he wouldn't find, was the real prize. Megan's clearance file. Her service record. Her commendations. All of it classified. All of it redacted. All of it protected by a law Hargrove understood intellectually but couldn't actually breach. The private investigator's report would come back nearly blank, which in its own way was the loudest confirmation possible. This woman had disappeared into civilian medicine with the kind of thoroughness that only happened when someone had been important enough to make disappear. But Hargrove didn't think that far ahead. He thought only about the Medicare fraud that had been running for 8 months, ghost consultations billing out at $430 per consultation, documented in the system but never actually performed. $847,000. Money that was buying a second property in Vail. Money that was keeping him ahead of 2 ex-wives and a gambling habit that wasn't technically a problem until you did the math. Megan's pattern recognition skills, her obsessive chart reviews, her insistence on continuity of care, those things were threats. Threats needed to be neutralized. Admiral James Kincaid arrived by ambulance at 1,430 hours on a Tuesday afternoon. 64 years old. Hemophagocytic lymphohistiocytes triggered by a latent CMV infection. His immune system attacking his own organs. Kidney failure. Liver failure. Respiratory collapse coming within hours. The ER attending called it a perfect storm of complications in the kind of voice that meant we don't know what to do. 7 doctors were assigned to his case. Hargrove from cardiology. Chen from surgery. Rodriguez from pulmonology. Patel from nephrology. Okonkwo from critical care. Strauss from infectious disease. Kim from hematology. 7 separate specialties converging on a single patient because nobody wanted individual responsibility. When a case was this complicated, complexity became protection. If the patient died, it wasn't any one doctor's fault. It was just the disease. Megan was assigned to his care on night shift. She arrived at 1900 hours to find the Admiral awake, alert, his daughter Sarah sitting in the chair beside the bed looking like she hadn't slept in 36 hours. The monitors showed the story clearly, oxygen saturation 94% but dropping. Heart rate 118. Blood pressure compensating for massive fluid shifts. A patient buying time with his own physiology, burning through reserves. She reviewed the chart. 7 consultations. 7 different treatment approaches. Contradictions layered into contradictions. One attending had ordered aggressive diuresis to reduce pulmonary edema. Another had ordered fluid resuscitation to protect kidney function. One had recommended plasmapheresis. Another recommended against it. The chart looked like 7 different doctors treating 7 different patients who happened to be occupying the same body. "Admiral," Megan said quietly. "I'm going to be taking care of you tonight. What do you need?" He looked at her for a long moment. "The truth about what's happening to me." "Your doctors are arguing," she said. "That usually means they're scared." He nodded slowly, as if that was the first honest thing anyone had said to him since he'd arrived. Sarah reached over and squeezed his hand. During hour 12 of the night shift, Megan performed a routine wound debridement on a post-operative site from the Admiral's emergency exploratory laparotomy. She worked with the particular precision of someone who had done this under artillery fire, who understood that every movement was a calculation, speed versus accuracy, damage control versus complete healing. Her hands moved through the motions with the muscle memory of 217 combat deployments. Field stabilization technique. Not taught in American nursing schools. Learned in the field, refined under pressure, encoded into the nervous system. Dr. Chen appeared in the doorway, watching. Megan continued her work. The packing pattern was flawless. Capillary bleeding controlled. Infection risk minimized. The kind of work that shouldn't be possible to do this way, this quietly, this perfectly. "That's a field stabilization technique," Chen said quietly. Her voice sounded strange. "Careful. That packing pattern isn't taught in civilian nursing. Where did you learn to pack like that?" Megan's hands went still. For a moment the only sound was the monitor beeping. The ventilator's mechanical sigh. The distant sound of a nurse calling for help in another room. "I watched a lot of training videos," Megan said. Chen's eyes narrowed. She stepped back out of the room without another word. But she had seen something now. The question was whether she would report it or protect it. Whether she would become another obstacle or something else entirely. Megan finished the debridement and moved to the Admiral's oxygen lines. The saturation had dropped to 82. Then 78. The 7 doctors would be converging soon. The machinery would move into place. And everything would change. And that's when the call came, not to her, but to Hargrove, that the Admiral's condition had become critical, that a consultation was being convened at 0300 hours in the ICU, that within 5 hours, 7 separate physicians would walk into a hallway and declare that Admiral James Kincaid was not salvageable. The Admiral arrived at 2,247 hours, still breathing on his own but barely, airlifted from Colorado Springs Memorial where the interventional cardiologists had already surrendered. His name was James Kincaid, 63 years old, and his heart was drowning in its own fluid while his kidneys shut down like a building losing power floor by floor. Multi-organ failure wasn't a diagnosis, it was a countdown. The ICU nurses knew the smell, acetone on the breath, the sweet copper tang of blood chemistry gone wrong, antiseptic layered over human decay like perfume on a corpse. His daughter Sarah sat in the family waiting area on the 3rd floor, hands folded so tight her knuckles had gone white, and no one had told her the truth yet because the truth was that her father would be dead by Wednesday. Megan was in the break room when the admission alert came across the unit tablet, a ping like a small bell tolling. She didn't look up from her coffee. The other nurses were already filtering out toward the ICU, moving with the practiced efficiency of people who knew the choreography of crisis. She waited exactly 90 seconds, then rose and moved back into the unit as if pulled by gravity, not choice. The Admiral's room was on the east corridor, the one with the window overlooking the parking lot where the July heat shimmered off the asphalt like a living thing. She could see his chart now, ejection fraction of 17%, creatinine climbing toward 4, lactate at 3.8 and rising. The numbers told a story her hands already knew how to read. She'd seen it before. In Helmand Province, in a combat hospital tent where the walls were canvas and the ceiling was stars and IEDs, you learn to read the body's language before the body quits speaking altogether. The first 24 hours were a controlled burn, aggressive diuretics, vasopressors at maximum infusion rates, continuous renal replacement therapy running through a femoral line because his arms didn't have enough real estate left for another stick. Dr. Hargrove moved through the unit like a conductor orchestrating an inevitable symphony. He ordered tests that wouldn't change anything, consulted specialists whose expertise meant nothing against multi-organ failure's arithmetic. The attending physicians rotated, Rodriguez from cardiology, Patel from nephrology, Okonkwo from pulmonology, Strauss from infectious disease, Kim from gastroenterology, and 2 others whose names blurred into the institutional machinery. 7 doctors. That number would matter later. By hour 48, the Admiral's lungs had begun their betrayal. ARDS, acute respiratory distress syndrome, pneumonia colonizing tissue that could no longer defend itself. The ventilator's rhythm became more aggressive, the pressure settings climbing like a climber on a mountain with no summit. Megan watched from the nurse's station where she had no right to watch, where Hargrove had reassigned her to the cardiac step-down unit 2 floors below. But the chart was accessible to anyone with credentials, and her fingers moved with mechanical precision, pulling his vitals every 15 minutes, tracing the trajectory of decline like someone reading tea leaves at the bottom of a cup. The 7 doctors convened in the hallway outside the ICU at 1,535 hours, and Megan knew it before she heard it because she knew how these meetings sounded, the shift in air pressure, the way conversation stopped mid-sentence, the particular gravity that descended when physicians stood in a circle and acknowledged defeat. She was in the stairwell when she heard Dr. Chen's voice carry through the doorway. His ARDS is progressing too rapidly. Lung compliance is cratering. Kidneys are shutting down. Patel, toneless, clinical, the voice of someone delivering facts about weather. He won't survive transport to a higher-level facility. That was Okonkwo, the pulmonologist, and in those 11 words lived the conclusion they'd all reached independently and together. The Admiral's lungs couldn't tolerate the helicopter ride. His organs had entered a phase transition, and no amount of medical intervention could change the vector. Megan pressed herself against the cool concrete wall of the stairwell and didn't breathe because breathing felt like movement, and movement might betray her presence. Hargrove's voice came next, carrying the particular tone of someone who was sorry without being apologetic. We've exhausted every protocol. I'm sorry. I recommend we present palliative care options to his daughter. Make him comfortable. That's all we can offer now. The meeting dissolved. She heard footsteps, the sound of people returning to their separate wards, their separate kingdoms of dying. She waited until the hallway had resumed its normal rhythm, the ventilator's mechanical breathing, the 4 pumps' percussion, the fluorescent light's persistent hum, and then she descended. The Admiral was dying at a rate of approximately 1 organ system every 18 hours. His oxygen saturation had dropped to 71% by hour 62, and the chart notations from the morning shift showed his wife had agreed to DNR status, do not resuscitate, which meant when his heart stopped, it would be allowed to stop. A mercy, they called it, though mercy looked a lot like surrender from the bedside. Megan found Dr. Chen in the hallway near the medication dispensary, and the words came out before calculation could stop them. There's a procedure. Percutaneous extracorporeal membrane oxygenation cannulation. ECMO. Developed for field trauma, high success rates with ARDS when standard protocols have failed. I read about it in Nurse O'Brien. Hargrove's voice emerged from behind her like smoke, like a threat spoken softly. He was standing 3 feet away, and she had no idea how long he'd been there, how much he'd heard. You are not assigned to Admiral Kincaid's care. You are not assigned to this patient. Return to your station on the step-down unit immediately, or I will file a suspension request with the nursing board before the shift ends. Do I make myself clear? She didn't flinch. She didn't blink. Her eyes moved from Chen to Hargrove, and in that translucent moment, something in her expression must have shifted because Chen took a half-step backward, and Hargrove's jaw tightened like he'd swallowed something sharp. Yes, doctor, she said, and the 2 words landed flat as stone. She returned to the step-down unit and sat at the nurse's station and watched Admiral James Kincaid's vitals deteriorate in real time on the monitor screen that shouldn't have been accessible to her but was. 70% oxygen saturation. 68%. His heart rate climbed, 120, 130, climbing toward the red line that meant decompensation was beginning. The kidney's urine output had dropped to almost nothing. His ammonia levels were rising, meaning hepatic encephalopathy was setting in, meaning his brain was drowning in toxins his liver could no longer process. The room, her room, the step-down unit, felt suddenly airless. At hour 72, his oxygen saturation dropped to 64%, and in that moment, no code blue was called because there was a paper in his chart that said no code blue should ever be called. Sarah Kincaid was in the family waiting room 3 floors up, drinking terrible coffee and holding a rosary that probably hadn't worked in 40 years, and her father was disappearing one breath at a time, and Megan sat at the nurse's station with her hands on the desk in front of her and felt them beginning to shake, not from fear, not from emotion, but from something older and more dangerous, readiness. The 7 doctors gathered outside the Admiral's room again at 1847 hours, and their body language had transformed from clinical to funeral. Defeated. Depleted. This was the moment when medicine's vocabulary ran out, when all the protocols and guidelines and peer-reviewed studies became wall decoration. Hargrove moved through their group with a clipboard and papers, and Megan watched as he made eye contact with her across the unit. Not a glance. Eye contact. A deliberate message in a look. I already prepared your termination paperwork. One more step and you're gone. She saw the satisfaction in his posture, the particular pleasure of a man who believed he'd successfully neutralized a threat. The Admiral had perhaps 90 minutes left. Megan looked at the ICU door, then at her badge with its picture of a woman the world didn't know, then at the locked medication room where the percutaneous ECMO cannulation kit would be stored, the equipment she'd trained with in another lifetime, in another identity, in a place called Marjah where people didn't make decisions about whether to save a life, they just saved it, or they didn't, and lived with what came after. Her jaw clenched. Her breathing deepened. Her hand stopped shaking. She rose from her chair. She walked toward the medication room. She knew Hargrove would be watching, and she also knew that some moments don't ask for permission, they demand it, and you answer with your body before your mind catches up. The Admiral's oxygen saturation dropped to 64% at 3:16 p.m. The monitor announced it with a series of urgent beeps, a sound like an alarm clock in a funeral home. Megan was checking his femoral pulse when she saw the number cascade downward on the screen, 64. 61, 58. His skin had taken on the waxy pallor of someone whose body was shutting down, compartment by compartment. Sarah Kincaid stood at the foot of the bed, her knuckles white as she gripped the metal rail. Dr. Hargrove wasn't in the unit. That was the only reason Megan's hands moved at all. She'd read about it 6 weeks ago in a military medicine journal, a technique called percutaneous extracorporeal membrane oxygenation cannulation, the kind of procedure that existed in the gap between impossible and necessary. Developed for battlefield trauma, for moments when transport was death and waiting was death and the only option was to steal time from the body's own collapse. She'd downloaded the journal PDF to her personal tablet on a night shift when insomnia had driven her to the hospital library. The article was authored by 3 combat medics from NECC who'd performed the procedure exactly 7 times in Helmand Province before it was deemed too experimental for standard protocols. Too risky. Too unpredictable. Too much like playing God. Megan had read it 3 times. She'd also read the footnote about how 4 of those 7 patients had survived. 71% when everything else had failed. When 7 doctors, Hargrove, Chen, Rodriguez, Patel, Okonkwo, Strauss, and Kim, had already walked out of the Admiral's room with the careful posture of pallbearers. She moved without announcing her intention. The emergency surgical kit was kept in the locked cabinet on the north wall, the one marked authorized personnel only. Megan had the key. She'd always had the key. 3 years of night shifts had made her invisible enough that no one questioned her access to anything. The cabinet door opened with a soft click. "What are you doing?" Sarah's voice cracked like thin ice. Megan pulled out sterile gloves, a 14-gauge angiocath needle, tubing, the cannulation kit with its coiled plastic arteries. Her movements were the movements of a woman who had done this before, not here, not in a civilian hospital with its fluorescent ceiling and its antiseptic smell, but somewhere that smelled like diesel fuel and blood and dust so fine it coated the back of your throat. Somewhere called Marjah, 3,000 miles away and 13 years ago. "Saving your father," Megan said. "I need you to trust me for the next 12 minutes. She locked the ICU door from the inside, a small gesture that felt like stepping off a cliff. The lock engaged with a metallic thunk that sounded like the closing of a cell door. The Admiral's femoral vein was accessible on the first try. Muscle memory was a kind of magic, the way your hands remembered what your mind had fought to forget. The needle went in at a 45-degree angle, through skin and fascia into the vessel, the slight give of tissue parting like water. She established flow through the first cannula with the kind of certainty that came from having done this while mortars fell, while a kid from Pittsburgh bled out on a cot made from ammunition boxes, while her own hearing went in and out like a radio losing its signal. Sinus rhythm. The words came back. Pain is data. Outside the door, Dr. Hargrove's voice cut through the glass. "Brian, open this door immediately." She didn't pause. The second cannula went into the femoral artery, a parallel track of access, and her hands moved with the fluid precision of a musician playing a piece she'd memorized in her bones. The Admiral's oxygen saturation crawled upward, 67%. 71%. Each number a small victory, a heartbeat of time borrowed from collapse. The door thundered. Hargrove was pounding against the reinforced glass with the flat of his hand, his mouth moving, and Megan couldn't hear the words, but she didn't need to. She knew the shape of his rage. She'd seen it in the break room when the other nurses scattered like startled birds. She'd felt it when he dressed her down in front of the Admiral's daughter, his voice coating the room like a thin layer of venom. Her fingers connected the tubing. Established flow. The oxygenator would do what the Admiral's lungs had stopped doing, would breathe for him, would strip the carbon dioxide from his blood and force oxygen back in, would give her father time. Would give her time. Sarah stood motionless, watching, her face a map of hope and terror. 78%. The security guards arrived with a master key card. 4 of them, radio static crackling from their shoulders, their faces showing the bewilderment of men who've been told to remove a nurse but hadn't been told why. The door swung open and the room filled with the sound of heavy boots on tile. "Step away from the patient," one of them said. Megan kept her hand steady as she secured the final connection. 81%. The cannulas hummed with their mechanical rhythm, taking over the work of lungs, and the Admiral's color began to shift from ashen gray to something that resembled the color of living skin. The guards grabbed her under the arms, not roughly, but with the firm grip of men doing a job they didn't understand. She let them pull her away from the bed, her eyes on the monitor, 84% and holding. Stable. He was stable. Dr. Chen rushed into the chaos, his surgical residence badge swinging from his neck, and stopped dead when he saw the setup. His hands trembled as he reached out, not to pull the cannulas, but to examine them, to trace the trajectory of the needles, to understand the geometry of what he was seeing. "This is a field stabilization technique," he whispered. "Military field medicine. Where did you learn to pack like that?" Megan didn't answer. The guards were already moving her toward the door, her body the only thing they could control in a room where everything else had spiraled into territory they hadn't been trained for. Hargrove's face appeared in the doorway, his expression a landscape of white-hot fury. His eyes locked onto hers and she saw the precise moment he realized what she'd done, not just saved the Admiral, but done it without him, outside his authority, in direct defiance of his declaration that the case was lost. He opened his mouth and closed it. Opened it again. "You're fired," he said. The words came out thin and precise, like knives slipped between ribs. "Security, escort her out. I want her badge, her access card, everything. Now." The walk through the cardiac unit felt like walking through an aquarium, everyone watching through glass, the sounds muffled and strange. Megan's scrubs were still wet where the Admiral's blood had transferred to her hands. A security guard whose name she didn't know placed her belongings in a cardboard box, 3 shifts worth of spare socks, a half-empty container of pain relievers, a photo of her son from last year's school picture. The box was the kind used for moving. The symbolic weight of it was so heavy it might as well have been made of lead. The drive home took 23 minutes. She drove the speed limit on every street, her hand steady on the wheel, her breathing controlled and even. The kind of breathing you learned when you were holding a tourniquet tight enough to stop arterial bleeding but not so tight it destroyed the limb. Proportional force. Measured response. She'd been trained to make decisions in moments where hesitation was death, and she'd been trained to live with the consequences of those decisions for the rest of your life. Her son was sitting at the kitchen table at 2:15 p.m. when she walked in. The termination letter was already there, printed and waiting, as if her presence in the house had somehow preceded her arrival. He looked up from his math homework, confusion crossing his face like weather. "Mom." His voice was the voice of a kid who didn't understand yet that the world could change in the space of an afternoon, that a mother could walk through a door still employed and walk back out fired. "Why are you home early? Your shift isn't supposed to end until midnight." She sat down across from him and didn't answer, because the answer was that she'd broken every rule, defied every order, locked a door from the inside, and done something that would either save an Admiral's life or destroy what was left of her own. She'd made the choice that a nurse wasn't supposed to make and a senior chief petty officer would make in the dark, in the dust, in the moments when the textbook burned and all you had left was training and will and the muscle memory of not letting people die. The termination letter sat between them like a verdict. Her tears dripped onto the laminate surface of the table, small circles of salt water that marked the geography of consequence. She didn't wipe them away. She didn't flinch from them. She sat there in her scrubs, the smell of antiseptic and blood still clinging to her skin, and waited for her son to understand that sometimes saving someone's life costs you everything, and sometimes the only way to keep moving is to accept that price before you even know what it is. Outside, the afternoon rain began to hammer against the windows with the kind of insistence that felt personal, as if the sky itself was bearing witness to what it meant to choose the patient over the protocol, the Admiral over your career, your conscience over your paycheck. Megan's hands, which had been so steady in the ICU, began to shake, not from fear, but from the moment finally catching up with her body, adrenaline draining away, leaving behind the raw exposed nerve of what she'd done. The rotor wash hit the east parking lot at 0600 hours, shaking windows across the entire cardiac unit. The helicopter descended through the Denver dawn like something summoned from a different world, sleek, military, impossible to ignore. For personnel in dress uniforms moved through the automatic doors with the kind of precision that made security guards step aside without being asked. They didn't announce themselves. They didn't need to. The woman at the information desk knew exactly who they were looking for. Senior Chief Petty Officer Megan O'Brien, the lead officer said. Not a question. A demand. Location. Now. The desk clerk's hands trembled as she reached for the phone. Within 90 seconds, every person in the hospital knew something extraordinary was happening. Nurses whispered. Residents stopped mid-chart review. The cardiac unit, which had been running on the exhausted rhythm of a graveyard shift, suddenly crackled with electricity. Megan's 13-year-old son, Daniel, still sat in the lobby where he'd refused to leave all night. He'd camped out in a plastic chair, using his mother's abandoned phone to scroll through nothing, waiting for her to explain why her shift had ended at 2:11 a.m. instead of midnight. Why she'd come home crying. Why she'd never cried before. He watched the full uniformed officers move past him toward the elevators with the kind of focused intensity that made his stomach tighten. One of them paused. Looked at the boy sitting alone with a hospital visitor's badge clipped to his jacket. You waiting for someone, son? Daniel's voice came out smaller than he'd expected. My mom. I think she's a nurse here. The officer's expression shifted. Something flickered behind his eyes, recognition, maybe. Or respect. What's her name? Megan O'Brien. The 4 officers exchanged a glance that Daniel would spend the rest of his life trying to understand. The lead officer knelt down, and Daniel realized he was looking at someone with captain's bars and a chest full of medals that meant nothing to him but clearly meant everything to everyone else. Your mom is a lot more than a nurse, son, the captain said quietly. Your mom is a senior chief petty officer. She's got 2 Navy Crosses, a Silver Star, and 4 Purple Hearts for actions in Marjah. He paused, and the weight of those words settled between them like something physical. She's a hero. Daniel's throat closed. He couldn't breathe properly. His mother pushed a mop. His mother wore scrubs. His mother cried at 2:24 a.m. holding a termination letter. His mother was not this. Upstairs in the administrator's office, Dr. Hargrove was still on his second cup of coffee, still believing his calls to the board chairman would be returned, still operating under the assumption that clearing out a Navy nurse with a fake write-up was the same as clearing out any other problem. The SEAL team leader found him without asking directions. Presence like that moved through buildings the way sharks move through water, other creatures parted automatically. The captain closed the office door behind him. Didn't sit. Didn't shake hands. Just stood there in dress blues with the kind of calm that comes from having already survived the worst the world has to offer. Admiral James Kincaid regained consciousness an hour ago, the captain said. His voice was granite. First thing he asked for was the nurse who saved his life. Senior Chief O'Brien. Hargrove's face went pale. The captain continued without mercy. She performed an experimental percutaneous extracorporeal membrane oxygenation cannulation procedure. A procedure 7 doctors in this hospital said was impossible. A procedure she pioneered under fire in Helmand Province. I don't understand. The Admiral identified her by a faded Seabee unit patch sewn inside her jacket lining. Same unit patch from the operation where she pulled his son out of an ambush in 2012. The captain moved closer. Not threatening. Worse than threatening. Absolutely certain. The Admiral has been waiting 13 years to thank someone for that. Yesterday, she saved his life using skills she learned in the same place. Senior Chief O'Brien walks through locked doors. She saves people 7 doctors have already given up on. And you tried to bury her with a write-up. Hargrove's mouth opened. Nothing came out. Her medical file note was transferred to Navy records this morning, the captain continued. Patient states the nurse who saved his life deployed with NECC to Helmand Province. That's now part of an official medical record. That's now part of a chain of custody that reaches all the way to the Pentagon. He paused. Let the silence build. "You're finished here, Doctor." The same security guard who'd handed Megan her cardboard box the previous day appeared at Hargrove's office door at 11:02 a.m. carrying an identical cardboard box. His expression was neutral, professional, but his eyes held something that might have been justice. "Dr. Hargrove," the guard said, his voice perfectly steady and carefully controlled, "I believe you know the way out." Hargrove tried to argue, tried to invoke connections, tried to threaten lawyers and boards and investigations. The administrator had already fielded 3 calls from people who used to return his messages immediately. The board chairman had thrown him under the bus with surgical precision. The Colorado Medical Board had received a detailed complaint from Dr. Chen documenting 8 months of fabricated billing codes. The private investigator's line had gone dead. The network that had always protected him had evaporated overnight, and Hargrove walked through the cardiac unit carrying his cardboard box while staff members watched in silence. Nurse Rodriguez whispered to another nurse. He called her incompetent. She saved an Admiral with a procedure 7 doctors didn't even know existed. The automatic doors closed behind him. In the ICU, Admiral Kincaid was sitting up for the first time in 72 hours, asking for Senior Chief O'Brien personally. 18 months later, Megan O'Brien stood on the deck of USNS Comfort in her Navy service dress blues. The wind caught her uniform, and her hands, the hands that had held intestines while mortars fell, the hands that had locked an ICU door and defied 7 doctors, were steady as surgical steel. Admiral Kincaid himself prepared to pin on her new rank insignia during a ceremony attended by 200 personnel. The sun gleamed off the metal at his chest, off her new bars, off a future that had seemed impossible from a kitchen table at 2:36 a.m. Senior Chief O'Brien walked away from the Navy because Marjah gave her PTSD she thought would never heal, the Admiral said to the assembled crew, his voice carrying across the deck like authority made audible. She chose anonymity and a quiet nursing job to recover. But when it mattered most, when every protocol and every superior officer and every reasonable person told her to step back, she chose courage over invisibility. Daniel stood in the front row, 15 years old now, wearing a visitor's badge, tears streaming down his face as he finally understood his mother. Dr. Chen, who had quietly documented Hargrove's corruption for months, stood at attention in Navy Medical Corps whites. The ceremony concluded with precision, with honor, with a kind of recognition that doesn't erase trauma but transforms it into purpose. Someone in the crowd would later report seeing Dr. Hargrove teaching CPR certification at a community college in Aurora for $16 an hour. His medical license suspended pending investigation. His network dissolved. His future as small and quiet as the life he'd tried to destroy. But Megan didn't think about him. Not anymore. She thought about the Marines in Marjah. The Admiral in the ICU. Every patient who needed someone willing to lock the door and do what 7 doctors won't. "You saved my life with a procedure you learned in hell," Admiral Kincaid said, shaking her hand after the ceremony. Megan's response was quiet, absolutely steady, the voice of someone who had nothing left to lose and everything to gain. "I learned it to make sure hell didn't follow me home, sir." The Admiral smiled. Understood completely. Megan walked the ship's corridors in full uniform, no longer invisible, no longer hiding, the weight of recognition sitting differently on her shoulders than she'd expected. Not lighter. Different. Purpose made physical. The quiet nurse had become something else entirely, not because anyone asked her to, but because she'd been willing to act when the moment demanded it. If you've ever been underestimated and then proved everyone wrong, hit that subscribe button and let me know in the comments. Have you ever judged someone only to find out you were dead wrong? What would you have done in Megan's position? And if you want more stories about people who sacrifice everything for what's right, make sure you hit that notification bell so you don't miss a single one. Subscribe. Like. Comment. Share this with someone who needs to know that sometimes the bravest warriors carry stethoscopes, not guns.